Hi, I'm Chuck Harwell, Community Bank of Dublin, Lawrence County. Stop by and see us today. For a car loan, a boat loan, vacation loan, any type consumer loan you may need, you can get your answer today, not 2 days, 3 days from now, by local lenders involved in the community. Community Bank of Dublin, Lawrence County, serving Dublin for over 12 years.
Hello, ladies and gentlemen, and welcome to Real Talk here on TV 35. I'm your host, Pat Brock, and we're featuring a very special lady we've got in the studio with us, Dr. Rosyln Banks-Jackson. How are you?
I'm good. How are you?
Doing well. Great to see you.
You too.
Now, this is a perfect opportunity for you to meet Dr. Banks-Jackson in a way where we women normally, a lot of times, you get us in so many different positions, us ladies, no pun intended. But this is now for the community to really get to know you. So share with us a little bit about you and your family and your journey, if you would.
Okay. Well, I've been practicing OBGYN for about 16 years.
Mm-hmm.
I'm married. I have 2 daughters. They are 16 and 19.
Mm-hmm.
And I joined Dr. Chisholm last year. And that's just been an amazing thing to work with him. He's a really awesome person. I love Fairview Park Hospital.
Mm-hmm.
They've got a really sharp nursing staff there. They've got a
Mm-hmm.
very solid unit. It's a wonderful place to have a baby.
Yes.
And I'm just really excited about where I am today.
That's wonderful, and we're certainly excited to have you here with us. We talk to so many people, Doctor, and a lot of times we want to know what that journey has been like for you. Now, were you that little girl that's always grown up wanting to be a doctor, or did you kind of change through the years by your experiences?
Yeah, I'm a person who always wanted it.
Yeah.
Ever since I was just 12, 13, 14,
Mm-hmm.
I always wanted to know what was going on the inside.
Right.
So, yeah, I think I always wanted to be a doctor.
And we like to have a philosophy of how and why we do things. What's your foundation as far as why you do what you do?
Well, I do what I do because I love it.
Yeah.
I feel like it drives me. So,
Yeah.
I do it because practicing OBGYN is you develop very personal relationships with people
Right.
very quickly. And you share in really a monumental portion of their life. So that doesn't happen that often.
Right.
It's a huge privilege. It's a lot of responsibility too. But so that's what I do. That's why I love it.
That's awesome. When I think about all of my OBGYNs through the years, I've got 3 children. They're, of course, now 22, 19, and 18. I had such a special relationship with them. And I think that as a patient, that's something that's so very important to us, to be able to have that type rapport with our physician, because it's a very intimate, setting, and it's sort of, the circumstances that you meet us women, would you say?
Yeah.
Do you feel a type of advantage because you are a female?
Sure.
Yeah.
Absolutely.
Talk to us about it.
I think, it's definitely from obstetric standpoint because I've had children. So,
Right, right.
I think you can't really understand what it's like to have a life growing inside of you until you experience that.
Right.
I feel like you can feel that on a mom's belly.
Yeah.
But I think women understand that that's just something you can't really you can't really understand it till it happens to you, and it happens very early. It's not like at the end of the pregnancy. It happens very early. There's this whole kind of thing going on, and so I think I do think that it helps me to understand my patients a little bit better sometimes. Yeah. So there's some advantages there from that. And then I think from gynecology, the standpoint, of just dealing with women's issues.
Right.
There's a little bit of advantage. My male counterparts are wonderful, and they establish that environment so that they're free to speak. But,
and I think for females, I remember when my first time having to go to an OBGYN, I was like this, just so terrified. Do you see that a lot in the younger girls when they first start out?
We do. Yeah, and everyone's first visit is a little bit different, so it really depends on when you present.
Right.
But these days, when I really try hard. I think our college is really trying to set forth goals so that we can make this a lot more comfortable, and just really let young women know that this is a type of relationship that you want to establish for the rest of your life, for your
You're absolutely
health.
right. And I think that for being in the military, we had to move quite a bit.
Yeah.
And so I had one child born in Milledgeville, two children born in Kansas. And so I had to continue to establish relationships with my physicians.
Yeah.
And some I matched with, some I didn't, gel with quite so. But I love the fact that they would all kind of make sure that I was comfortable.
Right.
What do you do to put your patients at ease?
Well, I really just try to talk to them and go over what I think is going to happen at this visit, and then just figure out what did you want to come,
Right.
Why did you come today?
Right.
What do you need to get from this visit? Am I going to meet all of your needs today?
Yeah.
So I try to discuss that with them to make sure that they'll feel comfortable talking about whatever it is that they want to talk about.
Yeah.
And then, for people who are just have that terrified kind of deer in headlights, you know, like when I shake your hand and your palm is super sweaty.
Yeah.
I mean,
this is going to be a tough one.
I'm kind of are you feeling a little uncomfortable today?
Right.
It's it's okay. We all go through this, you know. And then I usually just try to hone in and just see, is there one particular thing that's making you uncomfortable, or is it just, it's enough that you're meeting a new doctor and that you're going to be a little bit exposed, and just kind of going over that with them, and just outlining what the exam is like, making sure that there won't be any surprises. Usually it helps.
Yeah. And I was thinking in terms of, I have an 18-year-old daughter, and she hasn't started yet, but I know she's going to have to. And so tell the people out there about the timing as far as when we should have our daughters to start coming to an OBGYN, and talk us through that.
So I think there's a lot of room for that, depending to decide about that. So I think probably maybe the more popular thing is when people are considering becoming sexually active, or becoming sexually active is kind of oftentimes when they present.
Right.
By age 21, we recommend that everyone come and have an OBGYN exam. So at least by that time. And then there's, some recommendations from our college for your first reproductive visit between the ages of 13 and 15.
Right.
And that may very well be, for a lot of people, that's going to be probably with their pediatrician or their family practice doctor, just discussing, that you will have a period, that's normal, that signifies you're entering a new stage of your life, or you're going through puberty, or, so that type of a thing. And then when people have period problems, a lot of times I will see them, a bit earlier. So it really kind of depends on what you're looking for. Sometimes I see younger people with their parents, and they just want me to talk to them about the changes that are going on in their body and how to talk and how to do that. And I'm more than happy to do that. Do
you find yourself in your job description having to be a counselor?
Sure,
in many ways?
Absolutely. Yeah.
Help talk us off the ledge. It's, and it's a very delicate, subject anyway that we're talking about. And we're going to talk more in just a moment. We're going to take a break. All right. We'll be back in just a moment, ladies and gentlemen, with Dr. Banks Jackson.
Hey, Brad, you're working on a song about planning for retirement, right?
Yeah.
I wrote you some lyrics.
You're writing now? Here's a man like you and me, retired after 18 years at QB. Kind of seems like it might be about you.
Which part?
All of it.
It's about retirement planning. I don't see it, Brad.
Nationwide is on your side.
Ready for some good barbecue? Come on by Southern Heritage Barbecue, 2276 Veterans Boulevard. Home cooked Southern barbecue served fast. Want a killer deal? Sandwich, chips, and drink, just $4.50. barbecue by the pound, mouth-watering ribs, or delicious Brunswick stew. All at Southern Heritage Barbecue, 2276 Veterans Boulevard. For those special orders, call ahead 275-4304. And check out our new banquet room. Southern Heritage Barbecue, Dublin.
We're back, ladies and gentlemen, with Dr. Roslyn Banks Jackson and having some very interesting conversations with her. Doc, I want to kind of continue on about what we were talking about when you were talking about the ages of these young ladies that should come in. Do you find it different with time as far as when young ladies actually start their menstrual cycle? I've seen when I was younger, when I was in high school.
Right.
But then you see girls now very young in age. Is there any science to that?
Yeah, we think it's based on nutritional factors and mostly nutritional factors. So yes, the average age is similar though. It's 12 to 13. But I definitely have had. I definitely know people who have cycles like as early as 10.
Right.
Actually, a lot of people who have cycles as early as 10.
The youngest I heard was 8 years old for someone in my family.
So that's
and as a mother, early. You're like...
Because that's a child.
Correct.
Yeah.
Correct. But that's still something that happens. That's not something that...
Right.
All right. And we also want to kind of, for pregnancies, I myself had high-risk pregnancies. And I had quite a few complications. And so we know that in your position, you have to deal with a lot of different cases that are not just cookie cutter.
Right.
Yeah.
There's no cookie cutter pregnancies.
There's none.
There aren't.
Yeah, there's none. And so we want to kind of give some preventative things as well for women's health. I know that you're definitely an advocate for that. And so
Absolutely.
Talk to us about, what we women need to do to make sure that at whatever age level that we're doing what we need to make sure that we're healthy and living our best life.
So I think for all Americans, but particularly for women, the number one killer of women is still going to be cardiovascular disease. So I think it's important that we try to maintain healthy diets, that we try to make sure that we're exercising and really stimulating our heart muscles and keeping our cholesterol under control and trying to keep our weight within a reasonable range. Those are really the things that are going to give you kind of longer term health issues. And then depending on, your age for screening, we do pap smears, of course. We recommend that people get those and have an annual exam. And then ladies around age 40 should be starting to have an annual mammogram.
Right.
And I feel like that, 1 out of every 8 women is going to have breast cancer. So it's not just people who have a strong family history.
Right, I was going to ask you.
It's like if you have breast, you have the possibility is there. So why not get a screening test for that? And we know early detection really increases your options and is very favorable for you. And we're doing a really good job with breast cancer these days. So I strongly encourage my patients to get an annual mammogram.
And I do as well. Fairview Park is wonderful. Actually, my sister, she's passed away, but Lizzie diagnosed her, she found the lump in her breast. And I always, every time I go for my mammogram, Lizzie's retired now, but I always want to squeeze her and thank the other ladies for just the professionalism and the care that they give for us, because with all of this, women's health, we're all so very sensitive about that with every aspect. And family history. I'm going to ask you this. So my mother passed away at 42 years old of a massive stroke. She had 14 children. Her first child at 14. The last child 11 months before she passed away.
Wow.
My grandmother lived to be 109 years old. So when you hear and was fishing the week before she passed away. And so I'm very cognizant of my family history. And when you hear something like that, what triggers do you get as a physician for someone in that family with the women's history the way it is from both sides?
Well, that's so radically different.
It's so radical.
So, and there's so few people who become centurions these days.
Right.
So that's an amazing. But then losing your mom in her 40s is, that's
I always think about that.
That's concerning. It makes me curious about what was going on there. I know you told me she had a stroke. I don't know if she had uncontrolled hypertension or
right. Like that's definitely a family history. And I remember I had to have vascular surgery from like a varicose vein. Talk to us about that, because my mother, from what I was told, I was a 2-year-old when she passed. When you see women with the spider veins and varicose veins, there's a seriousness to that.
So, yes.
Yeah.
Beyond, because that also leads to swelling, and then
Right.
it can cause pain, and then you don't have very good vascular return. And sometimes people have, that can be like a sign of poor circulation or
Right.
venous stasis or those kinds of things. Right.
And ladies and gentlemen, there's so many different questions I'm sure that you all would have, and I know we wouldn't have the time to answer that. But what are some of the questions that you get asked a lot, doctor, that would be beneficial for us to hear the responses to?
Some of the questions.
Yeah.
Well, the mammogram question is definitely something that comes up. And I should just mention that, one of the things that we really try to do in medicine today is we really try to individualize based on the belief system of our patients.
Right.
So there may be some people who would prefer to do mammograms every 1 to 2 years instead of every year. And if that works out best in their belief system and in their risk assessment, then that's, that can be okay too. And that's really true of most things. We really try to listen to patients and try to meet them where they're at.
Right.
People ask me a lot of questions about contraception, like what really works, what are the side effects, how is it going to affect me in the future if I want to have more children,
Right.
What's the best method for me. And so I definitely field a lot of questions about that.
That's definitely changed through the years, would you say?
Yes, absolutely.
I'm hearing things that I never knew existed.
Right. Well,
There's a patch.
There's a patch, yes. There's a patch. There's a subdermal implant.
Oh, my Lord.
There are intrauterine devices that become very popular now.
Right.
They are definitely not the IUD of the 70s.
Right.
It's definitely a different animal and very effective. A lot of ladies really like them.
Yeah.
We have a lot of options today for women to really sort of be in control of their reproductive health.
Right. And what about the ladies when we're past those years of reproduction?
Right.
Because you still want to make sure that everything is good.
Right. We absolutely. Maybe more now than ever.
Premenopausal and after. I mean.
Women can be perimenopausal for 10 years, like 10 years before they actually stop having a cycle for a full year,
Right.
which is the actual definition of menopause. And the age of menopause in the United States is about 51. That's the average.
I'm close.
Just around the corner, right?
Just around the corner.
But women experience menopause very differently, but I feel like everyone experiences it, and I feel like you really need to talk about it. Like, people have feelings kind of behind it, and then they have symptoms. Some people have hot flashes. Sometimes they feel like their concentration isn't great.
Right.
I mean, sometimes they feel like, I'm just not myself. What is going on here?
Right.
And we have options for treatment that are both hormonal and non-hormonal.
Right.
So it's kind of the same thing. We can take you where you are, figure out what your risk factors are, and really help you find what's going to work best for you.
And that's perfect, because I think that as women, I always say, women, we know our bodies. We know when something's not quite right. And I think that when we feel those things, we need to come see you.
Yes, absolutely.
And I'm not, I often, if there's something that just doesn't seem like it's quite right, if it's a little bit off kilter, as we say down here in the South, I make sure that I go see my physician and ask those questions and be very honest.
Right.
Be very honest. And sometimes it's difficult, I would say, to kind of tell you certain things because of,
Right. But that's
delicate.
okay.
It's
I
delicate.
mean, that's why we're here,
Yeah.
right? I'm your advocate. So
You are.
I'm your advocate, I'm your consultant. I'm here to get you what you need. But to do that, I got to get it out of you.
That's right.
So,
That's right.
you know, I have to be able to pull it out of you.
Yeah.
But yeah, that's why we're here.
Yeah.
And, you know, everything that goes on in the office is confidential. We don't discuss it over dinner later. We don't tell anyone at church. I mean, it's just, you know.
That's right, because
between us.
When we share with you, it's not something that you can actually see what's going on.
Right.
We go in there, we lay it out, and you all, it's your job to just take it on in.
That's right.
And we appreciate you for that. We appreciate you so much for that. And, you know, there are a lot of, what about the generation where a lot of people don't like to go to the doctor?
Right.
Some who have not had their annuals in several annuals.
Right. And so I really want to speak to those women, especially in this area and in the rural South. I really want to speak to those women because you know, women still develop gynecologic cancers.
Right.
So uterine cancer is very common, and you need to continue to get Pap smears, you know, up to age 75. So things don't stop because you stopped having children, or because your tubes are tied, or because you don't have a period anymore.
Yeah.
Really, there's not, the only doctor that really, you know, does a thorough exam, a female exam, an internal exam, or a good external exam, is generally going to be your OBGYN.
Right.
And so you still want to make sure that you're connecting with them, so we can we can diagnose problems before they get too far along, or we can prevent them from happening at all.
Very good.
So,
and this is getting them to get to know you better so that they can talk it up with you.
Yeah.
We're going to take another break. We'll be back, ladies and gentlemen, with Dr. Banks Jackson.
At Hangers Cleaners in Dublin, we really appreciate your business and strive for customer service and a better quality every single day. That's what we're here for. At Hangers Cleaners, we'll pick up and deliver right to your door, saving you time and money. Hangers Cleaners for all your fine linens, alterations, wedding gowns, leather, you name it, and we'll do it. Hangers Cleaners for your professional dry cleaning and laundry. Hangers Cleaners, the cleaner that cares. Hillcrest Parkway in Dublin.
Smalley's Animal Hospital has been a leader in animal care in the Dublin-Lawrence area for over 60 years. Dr. Jim Hobby, Peggy Hobby, and Michelle Hubbard are waiting to serve you today. The friendly and knowledgeable staff can help you with your pet no matter how big or how small. Smalley's Animal Hospital can even take care of farm animals. Smalley's Animal Hospital, 600 East Jackson Street in Dublin. Call today for an appointment, 478-272-2933. Smalley's Animal Hospital, mending God's creatures, great and small.
We're back, ladies and gentlemen, with Dr. Banks Jackson, and we're talking about some hot and heavy stuff here about us ladies and women's health, and we're so glad to have you in the studio with us to kind of share about some things that are very delicate, very sensitive, but at the same time necessary.
Absolutely.
All right, and so we were talking about the older generation of women and making sure that they go to the doctors and get yourself checked out, you know, to make sure everything's working, you know, whether or not they use it or not, you know.
Yes,
Keep talking.
Yes, you absolutely still need to go. And I tell my moms that I see, make sure your mom has been to see her OBGYN in the last few years. Like, it shouldn't be 10 years, it shouldn't be 6 years, it shouldn't be 5 years. She needs to be coming to see her like every 1 to 2 years.
That's right.
So
that's right.
You know that everything is okay.
And you know, because some people are stuck back in the day where I know several of my siblings were born at home, and so the care was not like it is today, the state-of-the-art technology that you have and so many things that you can detect, and early detection is so important. And so I want to also say this about people, young girls who are being sexually active, things that they need to be very cognizant of.
Yeah, and you know, the incidence of sexually transmitted diseases has been on the rise, and really just over the last couple of years is really increasing, kind of like 15% increase in gonorrhea, 15% increase in syphilis and chlamydia just over the last few years. And so we feel like some of that has to do with the younger generation really are not protecting themselves with condoms, kind of the way we promoted that in the age of AIDS, I think, or HIV. I feel like people don't see that as much anymore, and so that whole sort of fear has kind of gone away.
Right.
I think our adolescents haven't seen the worst of that, and so they have that kind of no fear, can't happen to me.
Right. Untouchable kind of thing.
Exactly.
Have you seen that in the teenagers?
We do. We see it in them, but and honestly, we're really seeing it in mature people as well.
Oh my gosh.
So we're talking college aged, and this is untreated sexually transmitted infections can lead to long-term pelvic pain and infertility, and just really horrible things that they'll have to deal with later on. So I really encourage people who are sexually active to get screened or to have safer sex practices.
That's right. For all ages. Exactly. And we want people to know how they can reach you. Where can they find you? I mean, tell us.
So I'm at Dublin OBGYN. We're in Erin Office Park, suite number 23. And our telephone number is 478-274-8580.
Wonderful. And how long have you been there with Dr. Chisholm?
Just about a year.
And how has that been for you? Because you've transitioned. I mean, you have moved all over the world. And to come here to Dublin, Georgia, how has that been for you and the relationship that you have with the staff at Fairview Park?
So I've just loved it. It's been really awesome. Dr. Chisholm is a wonderful person to work with. And his office has been very welcoming. The hospital's been nice. Very good.
Very nice. Well, we're certainly glad to have you here. Just listening, I hope that you are able to get some tidbits here of information, of course, learning about Dr. Banks Jackson, but also why she does what she does and why you love what you do. The patients, family.
I do. I just love the interaction.
Yeah.
I love sharing those special moments with the patients. I would say particularly my favorite thing is, like maybe on a weekend where you've been kind of up all night.
Right.
And, you're on call for Friday, Saturday, and Sunday. And then you just have like that special, you have a delivery where a lot of times it might be their first child or maybe not. It could be their fourth child. Who knows? It doesn't matter. But there's the moment where you put the baby up on mom's belly.
Oh my gosh.
And you just watch the mom and the other family, so their support person or the other family members. You watch that interaction as they realize they just had a baby.
I know.
And it's an amazing.
I was going to say that.
An amazing moment. Like
I think about it, even mine, I look at videos. I get teary-eyed now, I think because she's getting ready to leave for college, the baby. But I remember those moments with my physician and with the nurses who were absolutely outstanding. In that moment, you get to experience something that only few can say that they ever will.
Yeah, it's a huge privilege to be present for that. And I love it. It's one of those things that just kind of drives you.
And when you think about all the babies you've delivered in your tool belt, when you've got those notches, do you know a number of how many you've delivered throughout your career?
Oh, goodness. I really couldn't answer that.
That's right.
It's plenty. I can tell you that.
Yes.
It's plenty.
Do you ever have your patients come back with the babies and thank you?
Yeah.
When they're in good mind and spirits?
Well,
I say
it's a small world, and I've been kind of a person who's moved around, and every now and then, like, there'll be someone that I maybe, like, delivered very early on who I'll just run into. Like, I'll just run into them at some new facility, and they'll say, hey, you delivered my son, my daughter, you know, they're 10 now, they're 12 now, here's a pic.
How awesome is that?
And that's kind of, it's very awesome.
I was reading some of your reviews, and I tell you, just to hear the ladies talk about you as a person first and foremost, but the love and the care, the professionalism that they received from you, it changed their lives, it saved their lives, and it brought life into the world. And to read that, I felt as though I had already met you but today's my first time meeting you. And that's pretty special.
Yeah.
Because you're leaving a mark, you're leaving an indention. It's not just because you're a physician, but it's because of who you are internally and how that expands in what you do and how you do what you do.
Well, that's so, it's so lovely for you to say that.
Yeah.
But I do really feel it. I love
Yeah.
on my patients. I mean, you're probably really not supposed to do that, but I mean, you know, I do.
Yeah.
I have heartfelt emotion for my patients. I
Yeah.
try really hard to give them what they need.
Yeah. And as patients, we feel that. We feel the love. We feel when you care about us and when you don't care about us. You know what I mean? Mm-hmm. And so we're thankful because we're able to feel that from you, that you still admit that. You know, you give that aura off when you're doing what you're doing. Even when you're talking about something that's so delicate that can be very painful for us to hear, we still know that you care. And that's important. Thank you for that.
Well, thank you.
Ladies and gentlemen, this right here is Dr. Roslyn Banks Jackson. She's a great physician at the Office of Dr. Chisholm and Dublin OBGYN
Yes.
Associates.
Yes.
We're glad to have you here. We're glad to have you a part of the Fairview Park Hospital team. And if you'd like to reach Dr. Banks Jackson to be one of those new patients where she brings life to you. Here she is. Here's a face to the name and the face behind the accolades. Any last words, Dr. Banks Jackson?
Yeah, I'm just so glad I could come in and talk to you today. I really enjoyed it.
It's been such a pleasure.
Pleasure's all mine.
This is Dr. Banks Jackson, ladies and gentlemen. This is all the time we have for Real Talk here on TV 35. And please keep watching.